my name is Destiny. I'm a student nurse practitioner. I'm going to be taking your medical history today. So what brings you in?
I was just doing a yearly annual.
Okay. Any complaints that you've noticed recently?
Not really.
Okay. So I'm going to go over your past medical history. As a child, did you have any illnesses?
No, like real illnesses as a child.
Okay.
Just broken bones here and there.
What bones?
I fractured my tibia when I was 5, and fractured my collarbone, left collarbone twice.
And when was that?
Maybe when I was like 12, and again when I was 17.
And did you have any surgeries?
No surgeries.
Okay. Do you have any current medical conditions?
Just hypertension.
Okay. When were you diagnosed?
Maybe like a year and a half ago, maybe end of 2016.
Okay. Have you ever been hospitalized?
No.
And ever had any surgeries?
No surgeries.
Do you take any medications on a daily basis?
I take Norvasc, 5 milligrams for my hypertension.
And any like vitamins or minerals, herbal supplements?
No.
Okay. And have you had any recent tests?
No, I had some blood work like a year ago, but I need to have another follow-up
Okay.
blood work this year.
Anything pertinent that showed up?
No.
Do you have any allergies?
No allergies.
And what about your vaccines? Did you have all of those as a child?
Yeah, I've had all my vaccines.
Have you had a flu shot this year?
You actually got it 2 days ago.
Perfect. And have you ever had a pneumonia vaccine?
No.
Or a tuberculosis test?
Yes. Tuberculosis.
When was your last test?
Like in November of 2017.
Okay. So moving on to your family history, do you have any siblings?
I have an older sister, she's 35, and a younger brother is 22.
Do they have any pertinent medical conditions?
No.
And what about your parents? Do they have any medical conditions?
Hypertension and hyperlipidemia. That's the only thing they have that I know of. Yeah, both of them.
Do you know when they were diagnosed with those?
No, I know my dad's been taking meds for his hypertension and hyperlipidemia for, I don't know, at least 10 years probably. It's probably the same thing for my mom.
Okay. And what about your mother's parents?
No significant like medical history, other than like, yeah, nothing that's like medical.
Okay.
Yeah.
Are they still alive?
No.
And what was did they have any medical reasons for their cause of death?
I can't remember my grandfather's. It was back in 1999, so I don't really remember. But I think it was just kind of got sick and died.
Okay.
You know? And then my grandmother, she fell and broke her hip in like early 2010 maybe, and then just kind of steadily declined over the next 2 years, and then ended up passing.
Okay. How old were they?
My grandmother was late 80s, and then my grandfather probably in his 80s.
Okay.
Or late 70s maybe.
And what about your father's side, his parents?
My grandfather, I think he might have had diabetes. I can't remember exactly. My grandmother, I know she had diabetes type 2, and I know she had coronary bypass maybe times 2 or 3. I can't remember. This was like early 2000s.
Okay.
But yeah, they both have passed. I want to say 2001-ish.
Okay.
Both of them, and my grandmother, I want to say, what led to her cause of death would probably be just heart issues, and then her diabetes. Yeah, she had double bilateral leg amputations from diabetes. And yeah, I don't know. It was a long time ago, so I don't really remember the specifics.
And they were both older also whenever they passed?
Yeah, they were probably late 70s, early 80s.
Okay.
Yeah.
And what about any aunts or uncles?
For history, medical history.
Yes.
The only like significant history that I can think of is my dad's older brother. Dad died of colon cancer.
Okay.
Yeah.
So moving on to your personal life, tell me about your home life.
Live at home, have a 6-year-old,
Okay.
or an apartment actually, not home. But yeah, just working right now.
Okay. And what do you do for work?
I'm a registered nurse.
Awesome. And how is your sleep schedule?
I work nights, so my schedule's kind of all over the place. As far as sleep, I sleep, I think I sleep anywhere from 5 to 7, 8 hours on nights that I'm working,
Okay.
or day, yeah.
And do you feel well rested after you sleep?
Sometimes, whenever, sometimes I have to pick up my son from school, so I have to wake up a little earlier, so I'm sleeping like 5 hours and taking naps here and there. But, right away when I first wake up, sometimes I feel a little drowsy, but for the most part, I feel okay.
Do you have any religious beliefs, spiritual beliefs?
No, I mean, I'm technically Catholic, but I don't really follow anything, it doesn't really prevent me from having any kind of thing.
Okay. And what about your diet? Do you eat out a lot or cook at home?
I would like to eat at home more and make my own food, but sometimes kind of just on the run. So eat, either fast food, which is bad, or I don't really eat a lot of fast food, but sit down restaurants, but that's probably not any better.
Would you say like 50-50?
Probably, yeah.
Yeah. Okay. And what about exercise?
Not as much as I would like. Recently started doing Camp Gladiator, so I try to do 3 times a week, but I've been on a little bit of a break at the end of the summer, so trying to get to at least 2 times a week.
Okay, sounds good. Any drug, alcohol usage?
I drink alcohol, maybe 2 or 3 times a week, depending, and usually just a few beers when I do.
Okay. Any drug usage?
No.
Any tobacco usage?
No.
Okay, great. So now I'm just going to kind of review your symptoms and ask you if you've had any symptoms
Okay.
to review your symptoms. Generally speaking, have you had any fevers, chills,
No.
night sweats, fatigue, any changes in weight, purposeful or not?
Over the last year I probably gained like 10, 15 pounds, but I think that's just more from working nights, not eating right, and probably not exercising as much, so.
Okay. What about, have you had any headaches?
No headaches.
Or dizziness?
No.
Or fainting spells? Any numbness or tingling anywhere?
No.
Okay. And in regards to your eyes, I see that you wear glasses. Do you always wear glasses?
Yeah, I have glasses, contacts. Mostly wear glasses around home, but contacts when I'm not at work.
Okay. Have you ever had any, work done on your eyes, any surgeries or?
No, no surgeries or anything done with my eyes. I have a cataract in my right eye. Don't know. They don't know how I got that, and I don't know how I got that. But plan to do maybe cataract surgery in the future.
When did they discover that you had that?
Maybe like 6 years ago when I first went to get my eyes checked, or not first, but when I realized I needed glasses because things were blurry. That's when they noticed that I had it.
Okay. Any vision changes recently?
No.
Or sensitivity to light? Any pain, drainage?
No.
Okay. And then your ears, have you noticed any hearing loss?
No.
Or pain or ringing in your ears?
No.
And your nose, any changes in your sense of smell?
No changes. No.
Any congestion?
I do sometimes feel like I'm a little congested, and I use nasal spray. I can't remember what it's called.
You use that every day?
Yeah, like once a day.
Okay. Have you had any nosebleeds?
No.
Or any sinus pain?
No.
And then in your mouth, have you had any changes in voice?
No.
Any changes in taste? Sore throats, bleeding? ulcers, any dental work?
No.
What about in any cough or wheezes?
No.
Any difficulty breathing?
No.
Prior TB exposure?
No.
Okay. Cardiac-wise, have you had any recent chest pain,
No. No chest pain.
palpitations that you've noticed?
No.
Have you ever been told you have a murmur?
No.
Have you ever noticed excessive bruising?
No. No bruising.
Okay. Gastrointestinal, have you had any changes in appetite recently?
No. It's pretty normal for me.
Any nausea, vomiting,
No.
heartburn?
Mm-mm.
Have your bowel movements been normal?
Yeah, I would say so.
Any diarrhea, constipation?
No.
No blood in the stool?
Mm-mm.
Okay. Any hemorrhoids?
No.
And urinary-wise, have you had any difficulty urinating, frequency, painful, burning?
No. Been normal. Yeah.
Any drainage?
Mm-mm.
No. Ever had a hernia?
No.
And what about any joint stiffness or pain?
No.
Any generalized weakness or weakness in any of your extremities?
No.
Any difficulty performing any of your activities of daily living?
No.
Or any difficulties with mobility?
Mm-mm.
Okay. Skin-wise, have you noticed any rashes anywhere?
No. No rashes or anything.
Wounds?
Mm-mm.
Any swelling?
No.
Any excessive sweating?
I mean, nothing out of the ordinary. Just, yeah, normal sweat.
And mood-wise, have you had any mood changes?
No.
Any depression?
Mm-mm.
Thoughts of suicide?
No.
Okay. Do you have anything that you'd like to add to this?
No, I think you covered everything. I don't really think I have anything.
Okay. Any questions for me?
No.
Okay. Well, that concludes this part of the exam, and it was nice to meet you.
Nice meeting you.
Thank you.
Thank you.